it was for him.
Benard Muchere, who stirred the 5 billion shillings storm at Afya House, appeared for the first time before Senate's Health Committee to give his version of events on the curious transactions at Afya House.
I've been a subject of people saying that I came up with this report for the purpose of hitting the government. If there's anybody who is patriotic in this country, it's me.
Ministry of Health officials, the Cabinet Secretary and the Principal Secretary have said over time that the internal auditor did not share his findings with them so that they could respond appropriately. The internal auditor, however, says this was for their own consumption anyway. It was an appraisal to the Cabinet Secretary on what's been going on at the Ministry of Health.
We did it innocent to give the management the information. If it never leaked, we will not be talking about this issue.
Do you trust the report that leaked out?
Yes.
Among them, the diversion of 200 million shillings meant for the free maternity program, and that was instead used to top up payment for 100 mobile clinics at a cost of 10 million shillings each. Payments to the supplier, Estama Limited, was done in installments.
This procurement was done without sufficient funds to meet that obligation. For that reason, they paid from free maternity. And when Chairman, you can see the problem of entering into a contract without confirmation in the budget of sufficient funds.
He had also raised concerns about the eligibility of Estama Limited to get the contract since the company had no available tax records. The Office of the Attorney General had also said as much.
When I went to the EACC, I was shown a document which had a tax compliance certificate, but I could not authenticate it.
There were also concerns about some 515 million shillings from the ministry's supplementary budget that was used to buy foods and rations, the ministry says, for HIV patients living in arid and semi-arid areas. About 250 million of that money was deposited in the ministry's cooperative bank account to facilitate the issuance of a letter of credit for life care medics that was to supply the food and rations.
265,781,500 was paid to the Cooperative Bank of Kenya. Why?
When we asked about the payment to the Cooperative Bank, we never got an answer then. But later on, that's the time now you are given some papers where you are being told they were purchasing the rate of credit. Government entities are only allowed to bank with the central bank.
And even though the ministry has discredited his report and said he didn't give them a chance to respond to some of his queries, the auditor says he had trouble getting information such as payment vouchers from particularly the accounting and procurement departments. He says he saw some of the vouchers that he had asked for during his audit for the first time when he recorded a statement with the Ethics and Anti-Corruption Commission. The committee also heard about another elaborate plan at Afya House, this time touching on the National Quality Control Lab to steal 30 million shillings. Director Hezekiah Chepkwony said his signature authorizing the payments had been forged. A supply chains manager at the institution, identified as Irene Mukami, confessed to having been in on the plan. The payments were, however, intercepted and stopped. Sheila Sendeyo, NTV.